Hey guys, today our guest is Dr. Paul Mason. Dr. Paul Mason obtained his medical degree with honors from the University of Sydney and also holds degree in physiotherapy and occupational health. He is a specialist sports medicine and expert
Oh,
exercise physician.
you don't have to go with all that, BNS. I'm just a doctor from Sydney.
Yeah. So I'm very happy to invite Paul Mason to the show. Thanks, Paul, for coming to the show.
Well, it's great to be here, BNS. Thanks so much for inviting me on.
Thank you, Paul. Paul, before we go into the interview, can you share where can people connect with you?
Well, I do a little bit on Twitter. So Dr. Paul Mason at Twitter. I've got a YouTube channel. Again, Dr. Paul Mason. They're probably the two most common locations.
Thank you, Paul. Paul, my first question is, why do some people who look fit are metabolically unhealthy?
Well, it's because what you see on the skin doesn't necessarily reflect what's happening under the viscera. The interesting thing is, though, that most people who actually truly look healthy, when you actually dig down into their blood work, they often can be healthy. So it's not a question of looking fit, but it's a question of looking thin, because it's easy to be skinny on the outside and fat on the inside. That's what we call TOFI, TOFI. And that's very common because you can have visceral fat. Visceral fat is basically the fat that we refer to that's around your organs, usually associated with fatty liver. And if you've got fatty liver, then it's very likely that you also have insulin resistance. And as you well know, insulin resistance is the root cause of metabolic disease. So it's not about how fit you look, but if you were skinny, it is still possible to be very unhealthy.
Thanks, Paul. Paul, how do one know that they have metabolic syndrome?
Well, I mean, that's just a diagnostic criteria. So we have 5 different features that we use to diagnose it. And they're all sort of medical criteria. It'll depend on how high your blood pressure is, what your HDL level is, what your triglyceride level is, what your blood glucose level is, and what the measurement around your middle is, what we call the abdominal circumference. And generally speaking, if you exceed the threshold on 3 of those or 3 or more of those, then you'll be considered to have metabolic syndrome. But the interesting thing is, if you go back and look at each of those 5 diagnostic criterion for metabolic syndrome, they all relate back to the action of insulin. So if we have a look at blood glucose level, the job of insulin is to take sugar out of your circulation, one of the major jobs. And if the insulin's not working properly, your blood sugar level can increase. First problem with insulin. If we have a look at blood pressure, what a lot of people don't realize is that insulin actually tells the kidney, tells the body to hold on to sodium, which is in table salt. And when your body holds on to too much sodium, it actually draws fluid with it and increases your blood pressure. So again, high blood pressure in most cases is caused by high levels of insulin. If we have a look at the consequences of fatty liver disease, so fatty liver is strongly associated with insulin resistance and high insulin levels. And that leads to high triglyceride levels and lower HDL levels. And of course, being overweight, having what we call central adiposity, where you've got this, basically a rotund belly. Well, being overweight, that's an insulin-driven condition in a lot of cases. There is a very strong association of having high insulin levels and developing obesity or becoming obese. And in actual fact, it's very, very difficult for the body to store fat if you don't have high insulin levels. People with a type of diabetes where their body can't produce insulin, they actually waste away. They're type 1 diabetics. Their bodies literally waste away. Another type of diabetes, type 2 diabetes, of which there's a worldwide epidemic, that's associated with high levels of insulin and obesity. So metabolic syndrome, while we say, yes, it's these 5 criteria that we use to diagnose it, in reality, it all comes back down to insulin and insulin resistance. And I guess probably some of your listeners would be keen to know, well, what does insulin resistance actually mean? And I don't know if you've heard any good explanations yourself, but a lot of people get confused because insulin resistance basically just means your insulin does not work properly. So your body will compensate by releasing more insulin. So in actual fact, insulin resistance can usually be equated to having high levels of insulin. Of course, the organ in the body that secretes insulin is called the pancreas. And if that, for whatever reason, becomes damaged and unable to function, then it can't release as much insulin as it used to, and then your insulin levels will actually fall. And what a lot of people don't realize is that if you have persistently elevated blood sugar levels with diabetes, that sugar will actually damage your pancreas. It's through something called glycation. It forms advanced glycated end products. That destroys what we call islet cells in the pancreas that release insulin. And then even though your body needs more and more insulin because your insulin's not working, the insulin levels paradoxically fall. And that opens a real can of worms because then your blood sugar levels go absolutely crazy. And as you know, high blood sugar levels in your circulation, well, that just damages the blood vessels and it damages whatever organs those blood vessels are going to. It's the most common cause of eye disease. It's the most common cause of going on renal dialysis because of kidney failure. It's the most common cause of body part limb amputation. I mean, this is truly a terrible disease. It will double your risk of having a stroke. It will double your risk of heart disease. There's the consequences, the follow-on of this insulin resistance, if it's left unchecked, can be absolutely catastrophic.
Thank you, Paul. Paul, can you talk about denovo lipogenesis?
Yeah. So this sounds like a bit of an ugly word, de novo lipogenesis. So, I mean, de novo is sort of like creating something anew. Lipo is fat and genesis, making fat. So what a lot of people don't realize is that our body can turn something made of carbohydrate and turn it into fat. And in actual fact, our body can store carbohydrates as fat much more easily than it can store fat as fat. And at the outset, that seems really strange because it seems obvious that, if I'm eating the fat on the lamb chop, then that must be easily stored as body fat. It's actually not stored as body fat that easily. But if you have a donut or a bowl of cereal or some sugars or something like that, or mangoes or banana, whatever, carbohydrate, that can be turned as fat. So de novo lipogenesis is what happens when you deliver too much energy, basically often resulting from carbohydrate consumption, to the liver. So the liver is like a warehouse, a vault, and that can store a little bit of glucose as something called glycogen. It can store about 100 grams or thereabouts, so not a great deal. And if your stores of glycogen in the liver are a little bit empty, then if you're having excess carbohydrate, then that extra sugar, the glucose that you're having in the carbohydrate, will be stored as glycogen. But then what happens when your glycogen stores are full? Well, the liver will then turn that carbohydrate into fat, into a triglyceride fat. And then that triglyceride fat, what does it do? Well, it often ends up being stored in your abdomen or your organs or wherever, stored fat under the action of insulin. So de novo lipogenesis is the process where the body will convert carbohydrate and turn it into fat. And that fat very often is then subsequently stored in your stomach, on your hips, on your thighs, in your liver.
Yeah. Thank you, Paul. Paul, can we reverse type 2 diabetes?
So there's a lot of debate about whether you can or can't reverse type 2 diabetes and about the nomenclature that we use. Should we be saying it's in remission or should we truly say that it's reversed? I believe you can reverse type 2 diabetes. Now, the reason a lot of people believe that you cannot reverse it is they believe that a diet can keep it in check. But then if you revert back to your old diet, the diabetes would then rage on out of control. So let's go back and look at exactly what diabetes is. The definition of diabetes is having too much glucose circulating around in your blood. So then the thought process goes, well, if carbohydrates are made of glucose, and most of the glucose in your blood comes from what you eat, if you simply stop eating the glucose, that is, stop eating the carbohydrates, your blood glucose levels must be then well controlled, and therefore you don't have diabetes. Now, that part is potentially true in terms of the diabetes will be under control while you're not eating the carbohydrate. But then a thought process is, well, then if you just start to eat the carbohydrates again, then your metabolism must be as sick as it used to be, and your blood sugar levels would go straight up to, terrible, terrible levels. You see, people with diabetes, they don't have the same ability to handle carbohydrates that an average person does because their insulin is not working properly. Whereas you or I, we might be able to eat 100 grams of carbohydrates and our blood sugar levels wouldn't rise too much. Somebody with diabetes, that would send it up into the stratosphere. But the interesting thing is that it's possible to reverse insulin resistance. And if you can reverse insulin resistance, then you can restore a normal ability to deal with carbohydrates that people used to have in their younger years when they were more metabolically healthy. And I do a test called a Kraft test on a lot of my patients. And that's where we actually get a drink, and it's of 75 grams of glucose. In other countries, it's 100 grams of glucose. I'm not sure what you use in India. And then what actually happens is you drink that, and we follow your glucose levels over 2 hours. And the Kraft test is we also measure the insulin levels over 2 hours and see if they're also going too high or too low. And what we'll generally see is that people's ability to handle glucose over that 2-hour period after they've fixed their metabolism will often be back to normal. Their blood sugar, even when they consume the carbohydrates, their glucose levels don't rise anymore. And in those patients, I think it's safe to say you reversed their diabetes. Now, of course, if you go back on a crap diet, eating oxidized seed and vegetable oils and lots of sugar and stuff like that, can you unreverse the reversal? Of course you can. You can reverse the reversal. But it's fair to say that some people can truly reverse their diabetes with a healthy diet. And that doesn't just mean that only why they're eating a low-carb diet. It means you can also improve their tolerance for some carbohydrates.
Thank you so much, Paul. Paul, what happens if a poorly controlled diabetic consumes vegetable oils?
Well, it's not just a poorly controlled diabetic. It's anybody who consumes vegetable oils. It just affects poorly controlled diabetics worse. So vegetable oils, by their chemical nature, they have bonds that are prone to oxidation, and prone to oxidation rapidly. So that means if it's been sitting on the shelf for a week or a month or 3 months, it doesn't matter. That oil in the bottle sitting on your shelf, if it's vegetable or seed oil, is oxidized. And when you consume it, your body absorbs these oxidation products. The first thing is when we absorb fats, they get absorbed into something called chylomicrons, and they get transferred around our body through lymph channels and things like that. And these oxidized fats end up becoming a part of fats that get released by the liver, VLDL particles and LDL cholesterol, which you've probably heard about. That circulates around the whole body. And these oxidized fats, they're called lipid peroxidation, contained within these cholesterol molecules, get delivered to every corner, nook and cranny of the body, and they deliver their oxidation products. One of the biggest recipients of these oxidized products is the liver. And we've got very good evidence that drinking oxidized seed oils actually leads to fatty liver disease and contributes significantly to insulin resistance. And this happens in everybody. The problem is in people who are diabetic, because they're insulin resistant, their clearance of these oxidized fats is very much reduced. And that ends up with a much longer duration of oxidative stress to the body. It can take 3 days to clear oxidized products if a diabetic consumes oxidized seed oils. But having said that, even if you're not diabetic, oxidized seed oils are still not healthy. They've never been healthy. All the research, when we look at it with a critical eye, that research that's been done with a good methodology actually indicates, it tells the truth. It tells us that seed oils are dangerous. They just happen to be a little bit worse, or actually quite a lot worse, if you're diabetic.
Thank you, Paul. Paul, what do you suggest to the doctors and nutritionists who are not open to keto or low carb diets?
Well, it's not what I would say. It's what my patients would say. So I see patients every day who have been suffering in life with chronic health conditions. It can be joint pain. It can be just being overweight and having poor self-esteem from that. It can be having low energy. It can be being diabetic and having the multiple consequences of being diabetic. So, kidney failure, multiple infections, heart disease, having strokes. These are real things that absolutely can destroy people's lives. And my patients come to me and they're just incredibly frustrated that the solution for their multiple health issues has been obvious in the research for a long time. And they're outraged that nobody has ever thought to tell them that if they simply changed their diet, they could stop most of the medications, if not all the medications they're taking. They could lose weight. They could feel better. They could reverse their sleep apnea because they could reverse their kidney failure. They could reduce their risk of having a heart attack and a stroke. They could improve their memory. I mean, the benefits that people get when being healthy to being chronically ill is just amazing. It has an incredible impact on people's lives. And I think if doctors actually appreciated that there actually was a solution, and I don't know that doctors do it. Well, I know that doctors don't do it maliciously, but I believe they do it out of ignorance. And it's not good for the doctors either, because they get frustrated because they feel that they don't have treatment options for patients. The only option they have, what they've been taught, is to pull out the prescription pad and increase the dose or add something else. That's what medical training is all about. Medical training is not about giving sound nutrition advice and then de-prescribing. And I think if doctors were actually open-minded, the problem is we've all been led up the garden path. We've been fed a lie. We've had the food pyramid rammed down our throats for as long as we can remember, and we believed it. We've taken it on board. And it's very hard to consider that that might be a house of cards. It might be built on a foundation of sand. It might be completely and utterly wrong. And it absolutely is completely and utterly wrong. There's multiple pieces of evidence that the science has been completely and utterly misrepresented to the point where we now give dietary advice that is almost the antithesis of what it should be. And I think if doctors knew that, it would lead to much better outcomes for patients, and it would also lead to much more satisfying medicine. Do you know how satisfying it is to actually stop medications, to have patients come in and say, you know what, I don't need this medication anymore. I don't have any reflux. You know what, I haven't taken any anti-inflammatory this month because I have no more knee pain. This is incredibly satisfying medicine. It's win-win. I guess if you're a pharmaceutical company, maybe not, but for the people that matter, this can only be good.
Thank you, Paul. Paul, how do lectins affect our health, and what is the link between lectins and Parkinson's disease?
Well, let's first of all talk about what lectins are. So lectins are something we call a carbohydrate binding protein. So that's a bit of a fancy name. So what does that actually mean? Well, it's a protein that literally will attach to a carbohydrate or a sugar. And we have lectins contained in animal foods, and we have lectins contained in a lot of plant foods. And some lectins have actually been shown quite reliably to be associated with autoimmune disease. Now, for the most part, those lectins are plant-based lectins. So generally, when we talk about lectins, we tend to think of plant lectins because they're the ones that are most deleterious. And the most obvious lectin that everybody has heard about is something called gluten. And gluten is associated with a lot of autoimmune disease. We know that, so type 1 diabetes, where your body's immune system will actually attack your own pancreas from the inside, that's an autoimmune disease. And we know that mothers who consume the most gluten while they're pregnant, their children have double the risk of having conditions like type 1 diabetes than mothers who are consuming the lowest level of gluten. So have no doubt this is absolutely real. We know that gluten is associated with the most common autoimmune kidney disease called IgA glomerulonephritis. And there's actually done some studies where they actually take a biopsy, they actually cut a bit of the kidney out and measure the autoimmune reaction looking at something called antibodies. And they've shown that when people go on gluten-free diets, the level of these autoimmune antibodies fall. We've got a really nice pilot study looking at the most common autoimmune disease against the thyroid called Hashimoto's thyroiditis, and shows that when you put ladies with high levels of these antibodies, thyroid antibodies, on a gluten-free diet, over 6 months, these antibody levels reliably fall. So we certainly know that gluten is a problem, and gluten's not the only lectin. There's other lectins like concaverin A and wheat germ agglutinin, and some of these other lectins can actually stimulate the insulin receptor. And this is really powerful. You asked me to comment on something called de novo lipogenesis before, where the body basically turns carbohydrates into fat. Well, this is done often under the action of insulin. And the interesting thing is, they've got studies that demonstrate that the ability to force the conversion of carbohydrate to fat is stimulated even more powerfully by these lectins, some of these lectins acting on the insulin receptor, than even it is done by insulin itself. So they're certainly not benign. Now, Parkinson's disease is what we call a movement disorder in the brain. It involves something called the substantia nigra of the basal ganglia. It's basically something just deep within the brain. And it's characterized by people having a tremor. The movements are very rigid and they have trouble moving, initiating movement, and they're very stilted. They're often very unsteady on their feet. We see characteristic things. There's a few odd things about it, like when they handwrite, they have what we call micrographia. Their handwriting ends up getting very small. They sort of lose the ability to form letters normally. But the interesting thing is, the animal model of Parkinson's disease is based on something called P-lectin. So this carbohydrate binding protein that comes from peas. And if they want to study Parkinson's disease in dogs, they have to give the dog Parkinson's disease first. So they give them a chemical to increase the leakiness of their gut, and then they give them peas. And what actually happens is that P-lectin is able to travel its way from nerves, from the gut, all the way to the brain. It's called the vagus nerve. And those lectins then end up in this part of the brain, the substantia nigra, where they sit on neurons that secrete a neurotransmitter called dopamine. We call them dopaminergic neurons. And we've actually got some beautiful evidence that this occurs. So in the dog studies, they were actually able to attach a fluorescing molecule to this P-lectin. And so when you look at it under a microscope, you could basically see it glowing. And after they gave these dogs Parkinson's disease, they euthanized them and biopsied their brain. And they were able to see that these fluorescing or glowing P-lectin molecules were actually all accumulated in the substantia nigra of the dog brains. And then they cut these nerves, the vagus nerves that these lectins were traveling up from the gut to the brain on, and they found that they couldn't give the dogs Parkinson's disease. And then there was this beautiful study that was done in Denmark where they actually, what we used to do an operation called a vagotomy where we'd cut the vagus nerves because we thought it was good for stress ulcers. Completely and utterly wrong, but it used to be a very common operation. And in the Denmark population, they basically, if you've had a medical procedure done, they can accumulate the data from the whole population. They've got a fantastic medical record system there. And over a long period of time, I think it was 25 years or something, I haven't looked at the paper in a while, they found that if you'd had this operation, then your chances of developing Parkinson's disease was reduced. I think it was in the order of 47% or something like that, which is, I think, a really good indication that, yes, these lectins are a problem. And I think the fact that we use P-lectin as the animal model of developing Parkinson's disease is very illustrative. And I've had several patients who have actually come in, when I say, I think about 3 or 4, who have all said they used to consume either a lot of peas or a lot of peanuts, which is a legume, and they're called peanuts because they're sort of like peas. So I certainly think there's something there.
Thank you so much, Paul. Paul, can we use dietary approaches to treat and probably reverse dementia?
Well, we can absolutely use dietary approaches to treat cognitive decline in a lot of cases. So you're probably aware, BNS, that we now call dementia type 3 diabetes. And there's insulin resistance in the brain. So what does insulin resistance mean? So we said earlier, insulin resistance means insulin doesn't work properly. So if there's some parts of your brain that need insulin to take up glucose, then what happens if the insulin's not working properly? It means there's some parts of the brain that aren't able to take up glucose or sugar normally. In that situation, those brain cells are starved. They don't get the energy they need, so they're not going to work properly. That leads to cognitive dysfunction. So how do you deal with that? Well, is there a source of fuel to the brain, what we call a substrate, that doesn't require insulin? It's called a ketone. So if you go on to change your metabolism from burning carbohydrates to burning fat, when you burn fat, you can produce ketones, and these ketones can cross into the brain and provide brain cells. Even if they're insulin resistant, they can provide the brain cells with a source of energy. So in that case, we often see when we give people ketone drinks or something like that, they'll have an episode of lucidity. I just had a patient today who was telling me about her father, who in the nursing home, she couldn't control his food at all. But whenever she went, she'd give him some medium chain triglycerides, caprylic acid, a medium chain triglyceride oil. And she said while she was there would be a short period where he would come alive after she gave him that. And it would only be a relatively short effect, and then it would wear off after half an hour or thereabouts. But it's really telling that we can actually improve cognitive function in an insulin-resistant brain. And remember, type 3 diabetes is dementia. And I guess if you're interested, I've actually got a lecture provocatively titled, "Are You Smarter Than a Doctor?" And I do talk a little bit about some of the stuff on dementia there, and I've got some longer lectures on dementia. But the other thing is that dementia is often caused by bad diet. It is a metabolic disease. The brain is only 2% of the body's weight, but it uses 20% of the body's energy. So what that means is it's incredibly active energetically, metabolically active. So if there was any organ in the body that was going to be susceptible to a metabolic disease, it was going to be the brain. And it is. It absolutely is. I'll give you an example. We talk about this Alzheimer's gene. I'm not sure if you've heard of it, ApoE4. And a lot of people saying, oh, I'm going to get my ApoE4 checked because I want to see if I'm going to get dementia or not. And it's often stated a slight exaggeration, that if you have 2 of these ApoE4 genes, one from mum, one from dad, then your chances of developing Alzheimer's disease are increased by about 20 times. Now, it's not quite that high. It's probably actually lower than 10, but it still is a significant increase. So then the question comes on, well, is that truly an increase of that much in everybody, or is it only in those people who have metabolic ill health? And there was this really elegant study where they took a population from Nigeria. They looked at a city in Nigeria, and they looked at an ethnically identical city in Indianapolis in the United States, because these 2 cities were historically connected by the slave trade. So they actually had the same DNA. And this population of ethnic Nigerians actually had the highest carriage rate of ApoE4 in any population in the world. And then they said, well, if it's truly just a genetic thing, then they should be the same level of increased risk of Alzheimer's disease in the Americans and in the Nigerians. Now, I don't need to tell you that the state of metabolic health in America, with the average American, only 12% of Americans not having, at least one problem with one of the symptoms of metabolic syndrome, is atrocious. And that's what this study reflected. The rate of dementia in the American population was 2.5 times greater than the genetically identical Nigerian population. And there's reasons why the ApoE4 genetics is much more susceptible to damage through metabolic health. And I go through that in my lecture. But needless to say, good metabolic health protects against dementia. The brain is incredibly metabolically active. So if you have a metabolic disease, the brain is a sitting duck.
Thank you so much, Paul, for explaining clearly. Paul, what is your opinion on fish oil capsules?
I don't like them. Now, I've done an about turn on this. I used to recommend fish oil, and I'm sorry if you're one of my patients listening to this who, 5 or 6 years ago, I recommended fish oil. There was a study a couple of years ago in Sydney, and they went around to all the chemists in Sydney, and they purchased every brand of commercial fish oil that they could get. And they took it back to the laboratory and they did independent analysis. This was done through the University of New South Wales. And they found that there was not insignificant amounts of oxidation in every fish oil sample tested. In actual fact, the industry standard for oxidation, which is, shall we say, lax at best, a lot of them actually even exceeded this very, very lax industry standard. And this is very understandable because omega-3 oils is a highly polyunsaturated fatty acid. And we've already mentioned that polyunsaturated fats are prone to oxidation. Fish oil is no different. And when it's sitting there, it's oxidizing. And there's only so much they can do by adding additives to it to deal with that. So when you have vegetable and seed oils, they often bleach it to take away the odor of the oxidation. Your only real protection, if you want omega-3 fats, and I truly believe omega-3 fats are healthy, it's just that I believe oxidized fats are not healthy, that they are deleterious to our health, is get them from fresh food. So the definition of rancidity or rotten food is oxidation of the fats within that food. So if you're eating fresh food that's not rotten, the fats in that food are going to be non-oxidized and they're going to be healthy. And you can get omega-3 fats from grass-fed beef. You can get it from fish. There's lots of fresh food sources that actually do contain omega-3 in the amounts that you actually would need. So I say if you want omega-3, then just eat food that contains it and eat fresh food. But I recommend against any oil because to the best of our knowledge we have today, there is not one fish oil out there that doesn't contain oxidation. There's lots of people claiming it, but I've seen no scientific proof that it's possible to have a non-oxidized seed oil.
Thank you so much, Paul. Paul, how to reverse arthritis?
I assume you're talking about osteoarthritis here, which is generally what we call the wear and tear arthritis. And you can't reverse it. but you can make it feel a hell of a lot better. So the reason for this is that, let's go back a step. We've got lots of studies that show that when people lose weight, their pain significantly improves. The joint that we usually refer to when they talk about this in the research is knee, osteo-knee arthritis. And it's been said that a 10% body weight reduction can reduce the pain of knee arthritis by about 50%. So most of the data would actually suggest it's probably only about 30%, but that's still pretty significant. And if it was only due to the weight loss, then we'd expect it to be proportional. We'd expect a 10% reduction in body weight to lead to a 10% reduction in pain, not a 30% or a 50%. So why is it? So it's very well accepted now that it comes down to a cytokine effect, that circulating molecules within our blood, messenger molecules. And I can tell you what those molecules are. So if you actually think about it, you get a soup bone, like the one you're going to make a big soup out of, or you're going to give to a dog or something like that. And you know how you've got this shininess on the end of it. It's shiny, whereas the shaft of the bone is actually a little bit dull. So that shininess on the end is actually called articular cartilage. That's super smooth, super hard wearing. In actual fact, two sheets of articular cartilage rubbing against each other have less friction than wet ice. It's really smooth stuff. And apparently, I don't know how true this is, if you shoot a puck on ice, if you could shoot that same puck on human articular cartilage, it would go 6 times farther. So I don't know if that's true or not, but it's certainly a nice statistic to roll out from time to time. But basically, this is impressive stuff. Now, if you were to slowly grind this articular cartilage down, that's arthritis. And when we talk about grade 1, 2, 3, or 4, we're really just talking about, is it the first 25%? Are you in the next 50%, 75%, or how far through it are you? That's how we grade it. Now, you cannot, once you've worn away some cartilage, you can't replace it, but you can make it more resilient, what is left behind, because it doesn't actually have any nerves. So the fact that you've ground a bit away doesn't cause pain. But if it loses its function and doesn't absorb shock and protect the bone that's underneath, that bone has a lot of nerve and that can cause a lot of pain. So if we actually were to look at this articular cartilage under a microscope, what you would see is you would see a cell in the middle, and that cell is called a chondrocyte, and that would be surrounded by a protein scaffolding that we call the extracellular matrix. And that extracellular matrix is what actually makes the cartilage resilient and strong. And there's some things that can make the chondrocyte in the middle is making this extracellular matrix or this scaffolding all the time. And there's other forces in the body which are breaking it down. And if the forces breaking it down are much, quite high, then that means you can only secrete a very little and not a very stable extracellular matrix. So the resiliency of the cartilage and the ability to protect the underlying bone is going to be much reduced. So then the question is, what factors actually lead to breaking down of this scaffolding? And the only protein in our body that can break down that type of collagen is called a matrix metalloproteinase. Matrix metalloproteinase. It sounds awful, but basically metallo just means it's got a metal ion in there. Proteinase means it can break down protein. And matrix just refers to, it breaks down the extracellular matrix. So it's actually, an almost logical name. And they're made by the liver. Now, the liver normally makes a small amount in the background. It's what we call a constitutive secretion. It's always making a little bit. But if you have fatty liver disease, you make a whole lot more. And some of that extra stuff that gets made circulates around the rest of the body, and it gets exposed to your cartilages, to this extracellular matrix. So it weakens it. So it weakens all the proteins and all the collagen proteins in the body. And so that means that you're more likely to develop tendon injuries, which are also made of collagen. You're more likely to have arthritis pain because the lining of your joints is less resilient. So when you lose a little bit of weight, the beautiful thing is the weight that you lose first actually comes away from your liver. So even before you lose the pot belly, you're reversing fatty liver disease. You reverse fatty liver disease, reduce the amount of fat in the liver, the body makes less of these matrix metalloproteinases. We abbreviate them as MMPs. If you have less MMPs, then that means there's less of this breakdown stress on your articular cartilage. And even though you've got the same amount of cells, the same amount of chondrocytes, that hasn't changed. It means that the area around them, that scaffolding, is much bigger and much stronger and much more resilient, and that protects the underlying bones. And what we actually find, so I work with an orthopedic surgeon called Dr. Daron Sher. He's an excellent surgeon. But what we find is that when he gets his patients to lose weight and go on a healthy ketogenic low diet, low in seed oils, low in carbohydrates, about 30 to 50% of the patients who would have been booked in for surgery cancel. They no longer need the surgery. Is the arthritis reversed? Well, technically it's not reversed, but their pain's gone away. And that's pretty much the same thing.
Thank you so much, Paul. Paul, many people are afraid that if we eat too much protein, then it will raise uric acid levels. What do you say about that?
So it's very important to not be confused between the difference between urea and uric acid. So eating a lot of protein absolutely will increase your urea, but that can absolutely be a good thing. Let me tell you about one of the major benefits of this. In no way do I consider an elevated urea to be problematic. You'll urinate a lot of it out. There's a study done, I think it was in 1963, that actually showed that the most important factor in urine in terms of antibacterial activity was how much urea you had. And there's been several studies that have then looked at different diets. A few of them were in dogs where they were trying to actually induce urinary tract infections. And they found that they could give dogs who weren't eating much meat urinary tract infections, but when they fed them meat, they couldn't, because the urea in their urine was basically killing the bacteria before it could proliferate. So I would actually suggest that, especially for females, this is a particular female issue, if you're worried about UTIs and have a problem with urinary tract infections, then a high protein diet increasing your urea could certainly be a good thing. And for a little bit of extra bonus on top of that, I would supplement with a good mix of electrolytes, including sodium, potassium, and magnesium, because we also know that a combination of salts or electrolytes in the urine also exerts extra antibacterial activity. And I've had several patients who previously suffered from chronic UTIs. Some patients even have so many UTIs that they're on a daily antibiotic long-term permanently to try and reduce the risk of developing UTIs. And I've had patients who have been able to come off this, antibiotics every day is not a good long-term solution. Much better to have a healthy diet, high protein diet with good electrolytes. Very natural way to do it, and much more effective and no side effects. Uric acid is actually also often going up on a ketogenic diet, but that's something different. So uric acid is a breakdown product of purines. In some people, it can cause attacks of gout because it can crystallize and form these needles. When we look at it under a microscope, it's what we call negatively birefringent crystals when we do something called polarized light microscopy. That's just a fancy way of saying sharp needles that we can diagnose. And they cause terrible, terrible pain in a lot of people. So a lot of doctors get very concerned when they see a high uric acid level. A lot of doctors make the mistake where they assume that if you have higher uric acid levels, you must have gout. And that's absolutely incorrect. And I wish people would stop making that mistake. It just increases the possibility. Having said that, most of the purines and most of the uric acid we get doesn't actually come from meat in the diet. It's a big myth that meat is actually what causes an increase in uric acid, an increase in gout. You will get a transient increase in uric acid when you start a ketogenic diet because your body will start producing ketones, but the cellular machinery for your body to actually burn those ketones hasn't been upregulated yet. So the body says, I've got too many ketones. What do I do? Well, we're going to urinate them out. They pass out through the kidneys. and they share the same transporter that uric acid does. So if the ketones are leaving the body, they're actually making it harder for uric acid to leave the body. So you'll often get an increase in uric acid level for about a month or so after starting a ketogenic diet. The thing is, this doesn't lead to a surplus of attacks of gout. I think I've only seen one patient who's had an attack of gout while they've been on this kind of diet. And I would say that the chances are that that probably would have happened anyway. That was almost certainly coincidental. I see a lot of people who have histories of gout, and even though their uric acid level may go up during that transient period of a ketogenic diet, their chances of having an attack of gout are actually down. And it's actually my job to usually reduce the medications that people take to try and suppress their uric acid levels. They usually take a drug called allopurinol, which is what we call a xanthine oxidase inhibitor, which a xanthine oxidase is the enzyme that processes purines into uric acid. And I'm very successful in a lot of patients who have had a chronic history of gout. Once they're stable on a diet and they've lost a lot of weight and they're metabolically healthy, we say, well, let's stop the allopurinol and see what happens. 99% of the time, almost, I can't even actually recall a case where I've stopped allopurinol and they've had to go back on it. So uric acid related to protein is really not a valid concern. Urea related to protein might actually be beneficial.
Thank you so much, Paul. So now we have questions from subscribers, Paul. First question is, will high protein diets damage my bones?
That is no. That's the easy answer. But let's go back into it. So how did this myth arise that protein is bad for the bones? Well, it came over 100 years ago when we actually discovered that when people had high protein diets, there was higher levels of calcium in the urine. And people assumed that that calcium must have been leached from the bones. In actual fact, that is not true, because when you have a higher protein diet, you absorb more calcium from the diet. So, and if you absorb more calcium, then that means there's potential for more to then leave the body in urine, but it's not being lost from your bones. It's just being lost because you've just absorbed more. In actual fact, we have randomized controlled trial level of evidence that a high protein diet can assist in reversing osteoporosis. So there was this study done back in 2002, and they looked at supplementing with calcium and vitamin D. And they looked to see whether or not they could actually reverse osteoporosis. They followed people over 3 years and they did a bone density, a DEXA scan, dual energy X-ray, every 6 months over that 3 years. And this was menopausal females and males over the age of 65, I think it was. And what they found that on average, they could slow the bone degrading by giving vitamin D and calcium, but they couldn't restore it. And then they did something smart. They said, what happens if we stratify the results based on how much protein people are consuming? And they found that the group that was consuming the most protein actually reversed osteoporosis in their hip bones. Reversed osteoporosis. And this is really logical because bone is mineralized protein. It's protein strands that's got minerals embedded within it. So if you're trying to build more bone, you can't just give calcium because that's not the complete ingredients. You need all the ingredients. Bone has protein in it. 40% of the dry weight of bone is protein. So a high protein diet has been shown to be conditionally essential to actually reverse osteoporosis. Protein is good for the bone, full stop.
That's awesome, Paul. Thank you. Second question is, how to deal with PCOS? So
polycystic ovarian syndrome is a condition, a genetic condition. We believe it's genetically associated, that's got 3 main diagnostic features under what we call the Rotterdam criteria. The Rotterdam criteria is atrocious. It is very unreliable, but it's still what we use. So we look at whether there's cysts on the ovaries. We have a look at whether there's high levels of testosterone or what we call evidence of hirsutism, hair on the face, or male pattern baldness, or acne, or basically anything to do with testosterone excess. And we have a look at menstrual irregularity. So whether the periods are just really not coming very often, or they're the cycle is very variable. And we generally say that if you've got 2 of the 3, then you have polycystic ovarian syndrome. And that's, I think, doesn't reflect the complexity of the disorder. I believe it's on a continuum, and I believe people have degrees of it, and they might only have one of those symptoms, but definitely have it. The problem is polycystic ovarian syndrome is strongly associated with insulin resistance. So a lot of females who have PCOS, they're trying to lose weight with one arm tied behind their back. For them, they will generally be heavier on a particular diet than somebody without PCOS would be. And that's important to understand, because it means that, yes, it's not fair, but it does explain why these people might have troubles, and they know that they just need to be more diligent, and it sort of gives them an understanding of why they might be having troubles with their weight. And the best thing you can do for polycystic ovarian syndrome is actually improve your metabolic health. We often see levels of testosterone dramatically fall when people go on ketogenic style diets after with a diagnosis of PCOS. There's another supplement which is quite useful, and it's called myo-inositol. And there's several studies that show that that can be beneficial, and that can just overcome one of the particular deficits within PCOS. And a dose of 2,000 milligrams twice a day is what's usually studied. And I believe they also throw in 400 micrograms of folate as well. So that's certainly worth, for people with polycystic ovarian syndrome, have a chat to your doctor and see whether it might be worth supplementing with myo-inositol combined with a little bit of folate.
Thank you, Paul. Paul, next question is, should we limit our salt intake?
I don't believe so. I don't believe there's not sufficient evidence at this stage to limit sodium intake. So when we say salt, we normally talk about sodium chloride, and the sodium is what people get concerned about. Just for an example, I think it was September of 2017, the Australian Dietary Guidelines removed any upper limit for sodium intake for individuals. That means that I can now tell you to have as much salt as you would like and not be in contravention of the Australian Dietary Guidelines. And I believe that this upper limit was removed purely because there was no evidence to support it. In actual fact, in the document where they discussed this, they stated that by reducing the average intake to the guide of 2 grams a day, that would lead to an average reduction in blood pressure of 2 millimeters of mercury, an absolutely tiny amount. And if that's the whole premise of recommending a low salt diet, then that's ludicrous.
And Paul, like, it also raises the heart rate, right? So if it reduces the blood pressure, it raises the heart rate. So it's
that's often a compensatory mechanism. If you are the trouble is the fluid volume of your blood is governed by how much sodium you have. And if you don't have enough sodium in your blood vessels, then number one, you'll often feel thirsty because your body's saying, we need more fluid, we don't have enough fluid, so you'll drink a lot. But then because you don't have the sodium, remember the sodium's necessary to hold the fluid inside your blood vessels, so you'll end up urinating it out. So people on ketogenic diets, because you often need more salt on ketogenic diets, if they're finding that they're constantly thirsty and they're urinating a lot, so when they drink it just passes out, it's often a sodium deficiency. And one of the other major symptoms people will feel is that if they stand up quickly, they'll feel dizzy because their blood pressure isn't enough to maintain the blood pressure going up to the brain. You're basically starving the brain of oxygen, of its blood supply. So they're 2 common symptoms of sodium deficiency, easily fixed just by having more sodium in the diet.
Thank you, Paul. Paul, next question is, can you talk about meat and TMAO?
Sure. If TMAO is so bad from red meat, why do we not care about it from fish or from chicken? It's rubbish. These people who say you shouldn't eat red meat because of that, they're also saying you shouldn't eat fish or you shouldn't eat other white meats. Rubbish.
Thank you, Paul. Paul, next question is, how to boost testosterone?
Well, look, I'm not going to talk in too much about this, but just a couple of key points. What's testosterone made of? Cholesterol. If you want to provide your body with the capacity, the ingredients to make testosterone, you better make sure you've got enough cholesterol. One supplement which does come up from time to time that has been suggested to support sex hormone capacity, including testosterone, is boron. And that's a nutrient which is often deficient in our diets. And people will often be taking a dose of about 6 milligrams a day to supplement with boron. But there's a lot of other things that interact with sex hormone status, but that's probably two of the most obvious ones.
Thank you, Paul. Last questions from subscribers. How fructose causes hypertension in addition to fatty liver?
Well, fructose directly contributes to insulin resistance. So we've got some beautiful studies where they've actually had groups of children who have been consuming a lot of sugar, which is 50% fructose, 50% glucose. And they've taken out the fructose, but they've basically replaced it with same amounts of glucose. So the total carbohydrates have stayed the same, but the fructose has reduced. And in those studies, even very short periods, in the space of just over a week, they've been able to demonstrate significant reductions in liver fat. And have no doubt that liver fat is fatty liver is a direct cause of insulin resistance. Now, if you have insulin resistance, we said before, that means that insulin's not working properly. So then your body will increase the level of insulin. Now, the thing about insulin not working properly is it's very tissue specific. So while it might not work as it normally does in your muscle tissue, helping your muscles to take sugar out of circulation, it can still work relatively well at the fat level. So help your fat stores take sugar out. And it can still work quite well at the kidney level. And one of the jobs of insulin at the kidney level is to actually hold on to sodium. So that's actually a much more important factor for increasing the sodium in your body and causing high blood pressure than is the amount of sodium that you consume. If you consume a modicum of sodium but have very high insulin levels, your body's going to try very hard to hold on to all of that sodium. You can, on the other hand, consume a whole lot of sodium but have very good low insulin levels, and any excess sodium that you consume will just come out in your urine. High insulin levels prevent that from happening effectively. So fructose causes high blood pressure predominantly through the mechanism of insulin resistance. Now, it can also interact with nitric oxide levels via uric acid, and some of your viewers may have seen lectures by Professor Robert Lustig. He did a famous lecture that's about 11 years old now, and he's got quite complicated diagrams in there that demonstrate how fructose metabolism leads to changes in uric acid levels, which then lead to changes in nitric oxide. And nitric oxide is actually something that relaxes blood vessels and actually helps lower blood pressure. And if you interfere with that pathway, then that's another potential mechanism to increase blood pressure. But I believe the predominant one is the sodium retaining effects of insulin at the kidneys.
Thank you so much, Paul. Last question. Would you like to issue a 7-day challenge to our subscribers?
Yes. Well, I mean, absolutely. Well, here's the thing. The changes and the benefits of healthy eating can be incredibly rapid. So we've seen evidence. I've done MRI scans on people's fatty liver, and in the space of a week, we've been able to see that you can remove 30% of the fat from people's liver. So you don't have to do this for a long time to start seeing the benefits. And once you start seeing the benefits, you might not want to stop. So it actually makes a hell of a lot of sense to do a 7-day trial. You really don't have anything to lose. So all you have to do, it's really simple. So cut out sugar. So we're not even going to go low carb necessarily. We'll just say the two most toxic things in the modern diet are sugar and seed and vegetable oils. So cut out sugar and cut out seed and vegetable oils for a week. Make sure that you may want to increase the salt. Speak to your doctor before you do, obviously. This is, I'm not your personal doctor. So get it cleared by your doctor first, but then you may want to increase the amount of salt in your diet. Otherwise, you'll get what we call the keto flu. It used to be called the Atkins flu. And see how you feel after a week. And I promise you, you're very, very likely, if you're overweight, to lose a bunch of weight in that week. It's not unusual for people to lose a kilogram or more of fat in the first week. It's an absolute myth that the rapid weight loss at the start of ketogenic diets is only due to fluid loss. That is absolutely not true. And we can do body composition scans to prove that. But you do rapidly lose fat. So give it a go.
Thank you so much, Paul, for coming to the show and helping us to become healthy.
My absolute pleasure. Thanks so much for having me, BNS. It's been great to chat.